each year, World Tuberculosis Day is commemorated on the 24th of March to raise public awareness about the devastating health, social and economic consequences of the disease, to help step up efforts to end the global pandemic. The date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes TB. This paved the way for diagnosing and curing this disease. TB remains one of the world's deadliest infectious killers. Each day, over 4,100 people lose their lives to TB, and close to 28,000 people fall ill with the preventable and curable disease. The 2022 theme of World TB Day is Invest to End TB, Save Lives. It conveys the urgent need to invest resources to ramp up the fight against the disease. I am now being virtually joined from Lagos to discuss this global pandemic and possibly solutions for curbing the spread by health practitioner Dr. Obituyi Hamid. Good to have you join us. Dr. Hamid, can you hear me?
Yes, I can hear you. Good afternoon.
Good afternoon. So, I mean, if you listen to our introduction, it states here that over 4,100 people lose their lives to TB and every day, and then we also see that 28,000 people fall ill with the preventable and curable disease. That's a lot, and I'm wondering, because for most of us, what we know about TB is the fact that people are coughing. What more can you tell us about TB in terms of the causes and then prevention?
Okay, thank you very much for the briefing. Actually, according to WHO, that's the #1 World Health Organization. That's the #1 health organization in the world. Said that TB, actually tuberculosis, is a multi-systemic disease with predilection to the respiratory tract, and is the #13th cause of death worldwide. That is a leading cause of death worldwide. And in fact, 1/3 of the world population actually is living with TB. That's a third. For every 3 humans, 1 of them live with tuberculosis. So the disease actually is gotten from a bacteria, that is a bacterium rather, that is Mycobacterium tuberculosis, an acid-fast bacillus, which enters the respiratory tract, multiplies there, destroys the respiratory epithelium, that is the lining in the respiratory tract, and then goes into other systems of the body. Actually, there are certain risk factors for contact, for transmission of tuberculosis. The major risk factors include overcrowding. That's when you have a lot of people living in an enclosed space. Malnutrition, usually undernutrition, forms which include tuberculosis, which include kwashiorkor or marasmus. Then you have other infections like HIV, then other debilitating diseases, including diabetes mellitus, measles, and pertussis, are actually risk factors for tuberculosis. So tuberculosis is gotten, the respiratory form of tuberculosis is actually gotten from inhaled droplets from people that live with TB. When a person coughs in an enclosed space, the bacillus, that's the bacteria, leaves the respiratory lining and enters the mouth, and then it goes into the atmosphere in droplets. So other people who are not TB positive, that's those people who are exposed to these droplets, inhale the droplets, and then the incubation period starts immediately while it multiplies in the respiratory tract. After it has gained its entry into the respiratory tract, the bacillus is able to leave the respiratory tract through the bloodstream to other systems, including the reticuloendothelial system, the genital system, and all other systems of the body. So the transmission of tuberculosis actually is quite basic than we think it is.
Absolutely, and hearing this now, it is contagious. So, and the funny thing is that a lot of people don't even know that they're living with people who have tuberculosis rather. But talk to us about, because I want to go with the theme for the year. It is invest to end TB, save lives. If we're to save lives, especially in a place like Nigeria, what areas should we invest in to ensure that people have access to treatment and people also know that, look, they have TB? What areas should we be investing in?
Okay, the health sector is actually doing a lot to ensure curbing the infectious disease, but we still have a long way to go, because as I've said, the disease actually, as I've said earlier, that 1 in 3 people is living with the disease. But so it is of keynote to say that the disease actually is a vaccine preventable disease. Yes, as you said earlier in your introductory talk, the vaccine was discovered in 18th century by Robert Koch. So and the vaccine is actually given at birth. It's a vaccine that is given at birth. Once given at shot, the person it confers a lifelong immunity to the individual. So number one thing about TB is actually that once you get the vaccine, that's number one thing. Then other secondary prevention for tuberculosis includes good nutrition, ensure that you are eating healthy, ensure that you are fine, ensure that you are not living in an enclosed space, and individuals, especially adults that have the disease, the active form of the disease, should ensure that they go to government hospitals or accredited private hospitals to get treated effectively.
All right.
The treatment form actually is a dietary observed treatment shortcut, which has actually been put in place by the Department of Community Medicine to ensure that individuals with the disease actually get treated effectively, and then they don't spread the disease to other individuals.
All right, thank you so much for talking to us, health practitioner Dr. Obituyi Hamid.